You've been lied to your entire life. They told you masturbation was dirty, that it was something you should have outgrown by the time you turn 50. But here's what no one ever said. After 60, masturbation isn't just normal. It could be the difference between life and decline. I know this because I've spent over 20 years treating men just like you. My name is Dr. Eisenberg, and I'm a urologist and professor of men's health at Stanford University School of Medicine. I've seen the silent consequences of neglect, shame, and misinformation. Too many good men have suffered not from illness, but from things they never knew. The truth is, most older men masturbate the wrong way, or worse, stop altogether. They don't realize that how you touch yourself, how often, and with what intention can shape your hormones, your heart, even your brain. Yes, one simple act done poorly can contribute to erectile dysfunction, depression, and even prostate problems. But done right, it can boost testosterone, improve sleep, and keep your vascular system alive. This isn't just about pleasure, it's about preserving function, reclaiming connection, and fighting back against aging where it starts, in the nervous system. In just a moment, I'm going to share 7 secrets about masturbation that every man over 60 should have been taught decades ago. But first, I want you to ask yourself, if one part of your daily routine held the key to better health, better mood, and better vitality, wouldn't you want to know what it is? Stay with me. What you're about to hear might just change the way you live the next 10 years of your life. Before we continue, take a moment to subscribe and turn on the notification bell. That way, you'll never miss another honest, science-based health insight made specifically for men in your stage of life. And if this message resonates with you, just type 1 in the comments. If it doesn't, type 0. Your feedback helps me create content that truly serves you. Now, let's get into it. Let me tell you a bit more about myself and why I'm so passionate about this topic. As I mentioned, I've spent over 20 years working with men just like you. I'm a urologist and a professor of men's health at Stanford University School of Medicine, where I've had the privilege of treating countless patients and seeing firsthand the effects of misinformation and neglect in men's health, especially as they get older. Over the years, I've heard the same concerns over and over again. Is it normal for me to feel this way? Why am I struggling now with things that used to come so easily? What's happening to my body? And perhaps most importantly, am I broken? Well, let me tell you this. No, you're not broken. But many men don't realize how simple habits, like the way they approach self-pleasure, can silently affect their health in ways they never expected. And it's not just about sex, it's about your overall well-being. This isn't a topic that's typically discussed openly, and that's exactly why I'm here today, to give you the real, honest answers that you may not have received in all these years. What I've seen in my practice, both in my patients and in the medical research I've been a part of, is that many men have been left in the dark when it comes to understanding how their bodies work as they age. We're often taught to believe that our physical vitality, including sexual function, starts to fade as we get older. But that's not the case. It's all about how you take care of yourself, how you engage with your body, and how you embrace your health as you age. And that's where I want to help. What I'm about to share with you isn't just opinion. It's backed by decades of experience and solid scientific evidence. It's information that could quite literally change the way you think about aging and your own body. So stick with me, and let's dive into these 7 secrets that could not only improve your health, but also bring vitality back into your life. Because, after all, you deserve to feel as good as you can, no matter what age you are. Now that you know a little about me, let's talk about why this conversation is so important, especially for men over 60. You might be wondering, why should I even care about masturbation at this stage in my life? Isn't it something I should have outgrown or stopped worrying about by now? Well, here's the thing. Your body doesn't stop needing attention just because the calendar says you're older. In fact, your body actually requires more care and attention as you age. What most men don't realize is that something as simple and natural as masturbation can be a key player in maintaining your physical and mental health as you get older. After 60, masturbation isn't just a means of pleasure, it's a critical part of maintaining your hormone balance, your vascular health, and even your mental well-being. How you engage with your body can help preserve key functions, prevent declines in health, and even improve your mood and sleep. The truth is, it's not just about sexual pleasure, it's about overall vitality and well-being. Many men think that they should stop, or that it doesn't matter anymore, especially after they've gone through life's challenges, whether it's losing a partner, experiencing physical changes, or simply dealing with aging in general. But the reality is this: neglecting your sexual health, or even stopping masturbation altogether, could actually be more harmful than you realize. You might be wondering, how could this really matter in the grand scheme of things? Isn't it just a small part of my routine? And that's exactly where I want to shift your perspective. This small part of your daily routine can affect everything from your testosterone levels to your emotional state, your connection with yourself, and even your relationships with others. There's no reason to shy away from the topic anymore. This is about learning how to approach masturbation in a way that supports your health, physically, emotionally, and mentally. It's about giving yourself permission to engage with your body in a healthy, intentional way that keeps you feeling vibrant, capable, and connected. So, let's take a deep dive into the 7 secrets that could transform how you approach self-pleasure, and more importantly, how it could change the way you feel every single day. The first truth might surprise you, but it's one every man over 60 should understand if he wants to maintain his vitality. Now that you understand why this topic matters, let's dive into the 7 secrets every man over 60 should have known years ago. These aren't just tips, they're powerful insights that could change the way you think about your body, your health, and your vitality. You've probably been misinformed about masturbation as you've aged, told that it's something you should stop doing. But the truth is, as you get older, self-pleasure is more important than ever. When done right, it can actually improve your health in ways you might not realize. I'm going to share 7 secrets that will challenge what you thought you knew about aging and sexual health. These aren't myths. They're based on science and years of experience treating men just like you. Think about it. If one simple change in your daily routine could boost your health, mood, and energy, wouldn't you want to know what it is? Stick with me. What you're about to hear could transform the next 10 years of your life. Let's start with the first secret, which is about mindless masturbation, something many men do unknowingly, and it could be quietly damaging your health. Let's dive into the first secret, one that could be affecting your health without you even realizing it: mindless masturbation. This is a habit many older men fall into, often without thinking twice. It's quick, mechanical, and over time, it can actually work against you. Here's the truth. If you've been rushing through the act, using the same hand, same motion, and same images, you're training your body and your brain to respond in a very specific way. And unfortunately, that routine can lead to numbness and even erectile dysfunction. I've had hundreds of patients come to me, eyes down, barely able to speak, confessing that they no longer feel anything when they masturbate. Some even say they need more pressure, more intensity, or even use tricks just to feel something. And this is where the real problem starts. Mindless masturbation creates a neurological conditioning loop, one that gradually diminishes your sensitivity. When you repeatedly engage in the same routine, rushing, tense, and disconnected, you're teaching your brain to associate arousal with that specific mechanical motion. Over time, you start needing more stimulation just to feel the same way you did before. And that can spill over into your relationships and intimacy, making it harder to respond to a real partner. It's not just a physical issue, it's emotional too. Many men start to feel frustrated, ashamed, or disconnected from their own bodies. But the good news is, this isn't something permanent. You can retrain your brain and body by being more mindful, slowing down, and reconnecting with sensation and emotion during self-pleasure. So, if you've been stuck in that cycle of mindless masturbation, it's time to make a change. Reclaim your sensitivity, reconnect with your body, and start doing it in a way that supports your health, not works against it. Now, let's talk about the second secret. Not masturbating at all after 60 might actually be more harmful than you think. There's a common myth that once you hit a certain age, you should stop thinking about self-pleasure, that it's something only young men do. But here's the truth. When you stop ejaculating, your prostate doesn't stop working. It continues to produce fluid, and if that fluid isn't released, it builds up, causing prostate congestion and inflammation. I've had patients like David, a 68-year-old man, come in complaining about frequent trips to the bathroom, waking up 5 or 6 times a night to pee, feeling pressure and discomfort in his pelvis. He thought it was just part of getting older. But when I asked him when he last ejaculated, he told me he hadn't had sex since his wife passed away. He thought that was just the way it was supposed to be at his age. What David didn't realize is that when you stop ejaculating, the fluid that's supposed to be released just sits there, causing your prostate to become swollen and inflamed. Over time, that can lead to more serious health issues like urinary urgency, weak urine flow, and even pain during urination or ejaculation. The real danger here is that many men chalk up these symptoms to getting older, but in reality, it's your prostate struggling because it isn't being relieved of that fluid buildup. Studies have shown that men who ejaculate at least 21 times a month have a significantly lower risk of developing prostate cancer compared to those who don't. That's not just a coincidence, it's science. The key takeaway here: don't stop engaging with your body. Masturbation, when done regularly, helps keep the prostate healthy and reduces the risk of chronic inflammation and the potential for cancer. So, if you've been thinking it's time to shut down your sexual health, think again. Regular self-pleasure is not just about sex, it's about taking care of your body and preserving your health. Don't let myths about aging control how you live your life. Your prostate and your overall health deserve better. Now, let's move on to the third secret, one that hits a bit closer to home for many older men: the shame around self-touch. This is something that most men carry with them for years, and it's incredibly damaging emotionally, mentally, and even physically. For decades, many of you were taught that masturbation is something to be ashamed of. You were raised in a culture where it was considered dirty, sinful, or something you simply outgrow. And over time, this shame becomes ingrained in your nervous system, impacting your relationship with your body and your own sexuality. I see it all the time in my office. Men in their 60s, 70s, and even 80s who are clearly uncomfortable when the subject of self-pleasure comes up. They shift in their seats, look down, laugh it off, or change the topic. The worst part is many of them stopped because they felt they were too old to continue or that it was inappropriate. But deep down, they still want to feel that connection, that vitality. They just don't feel like they have permission to pursue it anymore. What many men don't realize is that this shame, this emotional repression, is one of the biggest forces working against their mental health. When you're ashamed of your natural desires, you begin to withdraw, not just from self-pleasure, but from intimacy and connection with others. This disconnection takes a toll on your emotional well-being, and it can lead to frustration, loneliness, and even depression. Here's the thing. Self-touch, masturbation, is not inherently bad. In fact, it's a healthy part of self-care. It has been shown to regulate cortisol, boost dopamine, and increase oxytocin, hormones that support trust, connection, and well-being. When you allow yourself to experience pleasure without guilt or shame, you're also improving your mental health. You're telling your body that it's okay to feel good, it's okay to experience joy, even as you age. So let go of the shame. Stop carrying around that emotional burden that's been weighing you down for so long. Embrace self-touch with dignity, with care, and with awareness. When you free yourself from this guilt, you open the door to a more vibrant, emotionally connected life. Let's move on to the fourth secret. Testosterone is stimulated by sexual activity even solo. As you get older, it's easy to believe that your body's natural hormonal levels, including testosterone, just naturally decline. And yes, testosterone does decrease with age, but here's the key. This drop isn't purely age-related. In fact, it's accelerated when you stop engaging with your sexual self. That's right, when you disconnect from your own sexuality, your testosterone levels can drop faster than if you keep that part of your body engaged. Let me explain how it works. Testosterone is the hormone that fuels your energy, strength, confidence, and yes, sexual desire. It's vital for more than just sexual function. It affects your mood, muscle mass, and even how well you sleep. When you stop engaging with your sexual self, your body thinks it no longer needs to maintain a higher level of testosterone. Your brain starts to downshift the system because it's not receiving any reminders that you're still sexually active, that you still need that energy. I had a patient named Frank, a 73-year-old retired firefighter, who used to be full of life, full of energy. But over time, he noticed he was slowing down. He came to see me because he felt exhausted, like he was losing his spark. When I looked at his lab results, his testosterone levels were barely above clinical deficiency. But when I asked him about his sexual activity, he admitted that he hadn't had any in years, not with a partner and not by himself. The real issue here was that Frank had stopped seeing himself as someone who still needed to feel that connection to his own body. The good news? After we worked together and helped him reconnect with his sexual self through simple practices, his testosterone levels improved, and so did his energy, strength, and vitality. He felt more alive, more confident, and more motivated to take on the challenges he was facing. The science is clear. Sexual activity, even solo, helps to stimulate testosterone production. When you give attention to your sexual health, whether through self-pleasure or intimacy, your body responds by increasing testosterone. That's a signal to your brain and body that you're still engaged, still active, still alive. So, if you've been thinking that your sexual vitality has passed with age, think again. Masturbation is not just about pleasure, it's about reminding your body that it's still worthy of attention. And by doing so, you're helping maintain your testosterone levels, which directly impacts your overall vitality. Now, let's talk about the fifth secret. Erectile function is a use it or lose it system. This is something that many men don't realize until it's too late. If you're not regularly engaging in sexual activity, your body starts to lose its ability to respond the way it once did. And this goes beyond just the act of sex. It's about maintaining the health of your penis and the systems that keep it functioning. Here's the reality. If you don't use it, your body assumes you no longer need it. The penis, just like any other muscle in your body, requires regular use to maintain its strength, elasticity, and blood flow. If you're not stimulating it regularly, the tissues start to lose their tone. Blood vessels become less efficient, and over time, the tissues become stiff and less responsive. You may find that even if you want to be sexually active, you struggle to achieve or maintain an erection. I had a patient named Harold, a 69-year-old man, who hadn't had an erection in years. Not because he couldn't, but because he thought he didn't need to. His wife had passed away, and he figured that part of life was simply over. But what he didn't realize is that by not engaging with his body in that way, he was actively allowing his erectile function to deteriorate. The truth is, when regular erections stop, the smooth muscle inside the penis begins to atrophy. The delicate blood vessels responsible for engorgement become less efficient, and the production of nitric oxide, a vital chemical that helps trigger erections, diminishes. This process isn't just about sex, it's about blood flow, cardiovascular health, and keeping the tissues oxygenated. When you stop using that system, your body assumes it's no longer necessary, and it begins to shut things down. It's important to realize that erectile function is not just about your ability to perform in the bedroom. It's an indicator of your overall vascular health and cardiovascular function. Regular arousal, whether through sex or solo stimulation, keeps the blood flowing, maintains tissue health, and ensures that the system stays active. So, if you've been letting your sexual health slip because you're no longer in a relationship or you think you're too old for that part of life, think again. The body responds to use, and when you use it, you're signaling to your body that you still need it, that it still matters. Engage with your body, whether through self-pleasure or intimacy, and keep your erectile function intact. It's not just about your sex life, it's about maintaining your overall health and vitality. And the best part is, it's never too late to start again. Now, let's move on to the sixth secret. Porn can rewire your brain and impair sensitivity. This is a topic that many men, especially older men, don't want to talk about, but it's an important issue, and it's time we address it. As you might know, pornography has become more accessible than ever before, and many older men turn to it for a quick fix. But what most don't realize is that porn, particularly the high-speed, high-stimulation kind we have today, is rewiring your brain and your body's response to sexual arousal. The problem is that the brain wasn't designed to handle the extreme stimulation that modern pornography provides. When you watch porn, especially the more intense and graphic content, your brain releases large amounts of dopamine, the chemical responsible for pleasure and reward. Dopamine is great in the short term, it feels good, and it reinforces the behavior. But over time, as you continue to consume more porn, your brain becomes desensitized. You need more intensity, more novelty to achieve the same level of excitement. This is where the problem starts. For many men, this means that the brain's natural response to real-life sexual stimuli is diminished. In other words, it becomes harder to get aroused by real touch or intimacy. You may find that you're only able to perform with porn and you struggle to connect with a real partner or even with yourself without it. This is what's known as porn-induced erectile dysfunction, PIDE. I've had many patients in their 60s and 70s come to me admitting they still watch porn, not because they're obsessed with it, but because it's one of the few ways they still feel something. Some are living alone, some are widowed, and they use porn as a way to reconnect with their sexuality. But the reality is that the more they use it, the more they're disconnecting from their natural sexual response. The consequences of this can be severe, not just in the bedroom, but in every part of your life. As your brain becomes desensitized to real sexual pleasure, it starts to interfere with your overall sense of well-being. You can become anxious, frustrated, and depressed. You may start to believe there's something wrong with you, when in fact, it's the porn that's been altering your brain chemistry. But here's the good news. This is reversible. The brain is incredibly plastic, meaning it can heal and rewire itself. By taking a break from pornography, even if just for a short time, you give your brain the chance to reconnect with real, natural stimuli. You allow your body to respond to real arousal, to real touch, and to real intimacy. So, if you've been caught in the cycle of using porn as a crutch, consider stepping back from it. Reclaim your natural arousal response. Engage with your body in a way that doesn't rely on artificial stimulation. The more you reconnect with yourself, the more you'll reignite your ability to feel pleasure in a healthy, grounded way. Finally, let's talk about the seventh and most dangerous secret: isolation. Of all the risks older men face, this one is perhaps the most damaging. It's not just about being physically alone, it's about emotional and sensory isolation. When you stop being touched, when you stop touching yourself, when you stop connecting with your own body, you begin to lose more than just physical pleasure. You lose connection to yourself. There's a man I remember very clearly. Let's call him Peter. Peter was 76, a retired engineer, well put together on the outside, but when I asked him about his daily life, there was a hollow feeling behind his words. He told me he hadn't been physically touched in over a year. Not a hug, not a hand on the shoulder, nothing. He said it almost matter-of-factly, like it was just something that happened when you got older. He wasn't sad about it, but there was a quiet resignation in his voice, as if he had accepted that part of life had passed. What Peter didn't realize was that this kind of isolation, both physical and emotional, was quietly sabotaging his health. Touch is not a luxury. It's a biological need. The human body, no matter how old you are, is wired to crave physical connection. When you go too long without it, your nervous system begins to downshift. Oxytocin levels drop. Your stress hormones rise. Blood pressure increases. Your sleep quality worsens. And perhaps most alarmingly, your brain starts to shut down emotional and sensory circuits to protect itself. Essentially, when we stop being touched, we begin to go numb, not just physically, but emotionally too. Isolation, especially when it starts in the bedroom, can have a profound effect on your mental health. The body begins to pull back, not just from physical touch, but from life itself. This emotional withdrawal can lead to depression, cognitive decline, and a loss of purpose. And this doesn't happen overnight. It happens slowly, quietly, over time. But here's the key. You have the power to break free from this isolation. By re-engaging with your body, even through self-touch, you send a message to your brain that you are still alive, still worthy of connection, and still capable of feeling. You don't need to wait for someone else to touch you to reclaim that feeling. The act of touching yourself, whether for pleasure or simple presence, can help reverse the effects of isolation and bring you back to life, both emotionally and physically. What Peter didn't understand was that this isolation wasn't just keeping him from intimacy, it was making him feel like he had no purpose. When he reconnected with his own body, when he gave himself permission to touch and feel again, everything changed. His posture improved. His mood lifted. He started engaging more with the world around him, not because he had to, but because he remembered what it felt like to feel alive. So, don't let isolation rob you of your vitality. Reconnect with your body. Touch it. Feel it. Reclaim your sense of purpose and connection. You are never too old to experience the joy and fulfillment that comes from being in touch with yourself. So there you have it, 7 truths about masturbation and sexual health that every man over 60 needs to know. What we've talked about today isn't just about self-pleasure. It's about taking control of your health, your vitality, and your life. We started with how mindless masturbation can quietly damage your sensitivity and contribute to erectile dysfunction. We explored how stopping altogether can actually harm your prostate, leading to discomfort and even increase cancer risk. We discussed how shame around self-touch can wreak havoc on your mental health, making you feel isolated and disconnected. And we learned that regular sexual activity, even solo, is key to maintaining healthy testosterone levels and keeping your body engaged. We've also looked at the importance of preserving erectile function through regular use and how the brain can become rewired by pornography, making it harder to respond to real-world stimuli. Lastly, we discussed the devastating effects of isolation, both physical and emotional, and how reconnecting with your body can bring back vitality and purpose. Here's the bottom line. You are never too old to feel good in your own body. You are never too old to take care of your sexual health. And you certainly aren't too old to reclaim the vitality and energy that might have slipped away over the years. The good news is that it's never too late to start. You don't need fancy pills or drastic changes. What you need is awareness, patience, and a commitment to treating yourself with kindness and respect. You don't have to be perfect, but you do need to take the first step toward reconnecting with your body, your health, and your purpose. I want to leave you with a simple practice, what I call the Golden Protocol. This is a daily ritual of self-care. 10 minutes a day, quiet, intentional, respectful time to reconnect with yourself. No agenda, no pressure, just touch, breath, and awareness. You can do this in the morning before bed, or whenever it fits into your day. The key is to be present without judgment and without guilt. You don't have to do this alone. If you've felt disconnected, if you felt like you've lost a part of yourself, it's time to reclaim it. The first step is always the hardest, but I promise you it's worth it. Your body still remembers, it still wants to feel, and with a little patience, you'll find that spark again. So, let's not let age dictate our health or happiness. Let's be proactive about our sexual health, our mental well-being, and our connection to ourselves. Because no matter what, you're still here. And that matters now that you have the tools, the insights, and the understanding to improve your health and vitality. It's time to take action. I want you to remember one thing above all: you are never too old to make a change. Your body still has the power to respond, to heal, and to thrive. It just needs a little attention, a little care, and a lot of respect. I've shared these 7 powerful secrets with you today because I believe in your ability to live a fuller, more vibrant life. If any of these truths resonated with you, if they spoke to the part of you that's been yearning for a sense of connection, for a renewed sense of vitality, I encourage you to take the first step. Whether it's making small changes in your self-care routine, breaking free from shame, or reconnecting with your sexual health, the key is to start now. I want to hear from you. If you found this video helpful, or if you're already planning to take action, let me know in the comments. Share your thoughts, share your journey, or just type 1 if you're with me. Your engagement helps me know what's resonating with you and ensures I can create content that truly serves you. Also, don't forget to subscribe and turn on the notification bell. This channel is dedicated to providing you with honest, science-backed health advice that can improve your life in meaningful ways. I don't want you to miss out on future insights that could transform how you feel every day. Finally, take a moment to reflect on everything we've talked about today. This isn't just about self-pleasure, it's about living your best life, no matter your age. You have the ability to improve your health, enhance your well-being, and live more connected, empowered, and joyful. So get started today. Start small, but start now. Your health, your happiness, and your vitality are worth it. And remember, you're not alone in this journey. I'm here to help, and I'll continue to provide you with the information and support you need. Thanks for being here, and I look forward to seeing you in the next video.